Which agency regulates blood donation in India? This is my question. And worldwide, if we talk about blood donation, the agency which regulates blood donation worldwide is FDA, which regulates the collection, storage, and transfer of donated blood. And then the blood is sealed in plastic bag with preservatives and anticoagulating agents. So mainly CPD, that is citrate phosphate dextrose, is used as a preservative and anticoagulating agent. So donor must have specific characteristics, and those persons only can donate blood. That is, age should be between 18 to 60 years, and minimum weight should not be less than 45 kgs, and how much blood you can withdraw at one time is 470 ml, which is 80% of average adult blood volume. And how often you can give the blood? So you can give every 2 months, because body takes 8 weeks to replenish RBCs and WBCs. So whole blood you donate, right? So this whole blood is given to accidental victims, surgical patients, and whosoever in need. So the process of blood donation is different from the whatever donated blood you give to the patient. This process is called transfusion. So, but before transfusion, donated blood must be screened for diseases like hepatitis C. Also, while donating, you must have to calculate your hemoglobin and pulse level as well. That is, your hemoglobin should not be less than 12.5 gram per deciliter, and pulse should be between 50 and 100 per minute. So there are different type of transfusions, because not only the whole blood, recipients are given the components of blood as well instead of blood. Like 3 common is whole blood is given in various situations that we know, but there are 3 components which are made from the donated blood, like RBC, plasma, and platelets, which are given in different situations, right? So there are storage temperatures also for these different components. Like for RBCs, it should be stored between 2 to 6 degrees Celsius. So RBCs are given to a person who is bleeding or who has severe anemia, because RBCs has the capacity to carry oxygen. And plasma, which is also called as FFP or cryo, is given in patients with severe burn, infection, or liver failure, because plasma contains proteins, and we know that liver is responsible for making these proteins, and in case of liver failure you can't make these proteins, so you need to be given these proteins externally. And platelets should be given in patients with lower platelet count, for example in platelet disorders or in case of chemotherapy. And so one is autologous donation. If we talk about blood donation, autologous donation involves the patient himself or herself donates their own blood prior to their major surgeries. It is called as autologous donation. And while transfusion, if we talk about transfusion, patients should check every half an hour while transfusion, because they may experience various transfusion reactions such as acute hemolytic reactions, anaphylaxis, bacterial contamination, febrile reactions, fluid overload. And whenever you see this type of reactions, you must stop this transfusion. This is the first step while transfusion and you see any transfusion reactions. And what all these reactions I discussed, there are particular symptoms for this. For example, bacterial contamination, you will see the different symptoms. Anaphylaxis, you can see different symptoms. So this is all about blood donation or transfusion.